Now, people in the UK, indeed across the world, will be living with coronavirus for a very long time, according to some of the UK's leading scientists giving evidence to MPs today. Among them, Professor Chris Whitty, England's Chief Medical Officer, who defended his advice to the government on tackling the pandemic, saying that mass testing had to be abandoned because of capacity issues, and also defended the timing of lockdown. The latest figures from the Office for National Statistics show that coronavirus deaths in the week ending on 10th of July fell by almost 1/3 from the previous week in England and Wales, and deaths remained below the number usually expected at this time of year for the 4th week in a row. Today's latest figures show that 110 deaths were recorded in the UK in the latest 24-hour period. Our health editor, Hugh Pym, has the latest, including today's parliamentary exchanges with the scientists.
Moving on, people adjusting to life with fewer restrictions. But still there are many questions about government policy at the start of the coronavirus crisis. First, was lockdown too late? Streets emptied on March the 23rd when the full set of measures was introduced. Some have argued it should have happened a week earlier when only a partial lockdown message was used. MPs pressed the Chief Medical Advisor hard on what he said at the time.
I would have to go through all my notes to know exactly what conversation I had when.
Yes,
but you're basically trying to get me to go back and remember
I'm not
something where I wasn't expecting that question.
MPs wanted to know what the SAGE Committee of Advisers was telling ministers.
Were they following your advice?
Ministers at the time, who were put in an incredibly difficult position, in my view, followed the advice given by SAGE, which are clearly signposted through the minutes of SAGE, with a delay that was no more than you would reasonably expect for what are really very difficult things to operationalise and decide.
So was testing too slow? There's widespread capacity now, but in March community testing was on a much smaller scale and was controversially halted.
We had no capacity to do it on the scale that would have been needed for the kind of epidemic we had. And it's nothing to do with theory here.
But we got it up in 4 weeks. In April, we got the test capacity up to 100,000 a day in just 4 weeks. So if you'd advised doing that in January, we could have got to that stage by the end of February.
So SAGE was consistent, and I was consistent, in saying we needed considerably more testing capacity. Many of the problems we had came out of our lack of testing capacity.
So some tough questioning there for Chris Whitty over decisions affecting everyone's lives made back in March. And there'll be continuing scrutiny of what ministers and officials were doing and saying at the time. Today's hearing also looked at where things might go from here. How long will the virus be with us? One SAGE member said, forget the idea, it would fade away soon.
Things will not be done by Christmas. This infection is not going away. It's now a human endemic infection. And even actually, if we have a vaccine or very good treatments, humanity will still be living with this virus for very many years to come.
As for the vaccine, one government advisor said he was cautiously optimistic it would be in place by Christmas. Hugh Pym, BBC News.